Hi, I'm Dr. Albert Malvehy, and we're doing some foam sclerotherapy on a set of spider veins. Foam sclerotherapy is used for larger veins where we combine a medication like polydocanol with some gas, and that gas can be a physiologic gas like carbon dioxide, it could be room air in small quantities, and we use it to create a foam. So what I'm going to do is I have a syringe which has about a cc of a sclera, which is brand name polydocanol, mixed with about 2 parts of air. And we're going to hook that into a 3-way stopcock, and we're going to agitate it. And as you see here, it's clear liquid, clear air, and as we pass it through the stopcock, we're going to come up with a foam. So we're going to pass that back and forth 15 or 20 times, and we're actually going to tighten that up so that we get a nice thin, it's called microfoam. What that means is just that it's small bubbles. And once we have that pass through 10 or 15 times, we're going to get ready to inject. So here's a vein that I've already injected. Here, down from this side here, and we got this whole section. Now we're going to repeat the injection down here and then ultimately up here, but we're going to show this today. And so what I'm going to do next is simply prime the line, is just get some of the foam going through the butterfly needle there and have that ready to inject. Okay, and then what we're going to do is go ahead and get access here, a little poke, 1, 2, 3, and make sure that we're in. So if you zoom up, you can see a little flash of blood coming there, so I'm very confident that I'm in the vein. And now we flip the stopcock switch, and what I'm going to do now is I'm going to gently inject. And what we can see is that foam propagating very efficiently throughout the entire spider vein complex, all the way up the leg. And I'd like to get this guy right here, so sometimes we have to just encourage it in there. If not, we might have to inject directly into that little segment, which is fine. And you can see we've treated this whole section with just that one, and that used about half of what we had in there. So what I want to do is complete this injection, but I'm going to go directly in here. I'm going to come around that side. So I'm going to go ahead and do that now. So what I'm going to do is I'm going to withdraw. You can actually see the foam sort of coming out there. And what I'm going to do now is inject directly into some of these secondary sites here. And this is probably a little bit overkill, but we want to make sure that we get these. There we go. And so we'll go in and we'll inject directly in there just to get the remainder of those. Okay. And so as we inject, you can see the medication sort of propagating through where my finger is. I think that'll do it. And we'll withdraw, and you can see some of the foam coming out here. And this reaction of inflammation is exactly the sort of reaction that we're looking for. So you can see this is the treated vein section here. So this entire vein is inflamed and irritated, which is exactly the reaction that we want to see. So we know that vein is effectively treated, and within the course of right around 4 weeks or so, that vein should be gone. So, this is Albert Malvehy, vein specialist, signing off. Bye.